everyone.
Good morning.
I'm Rebecca Branch Griffin, and I'm Director of Health and Counseling Services at Virginia State University. I was going to correct you. Mrs. Moss Savage is our outreach coordinator, and Mrs. Tanya Satterwhite, nurse practitioner, is our clinical coordinator for health services. And our project involved cultural sensitivity and interprofessional collaboration with the LGBTQ student community at Virginia State University, especially as it relates to successfully accessing and receiving health and counseling services. We've come to the conclusion that this population is not going anywhere. And because of that, we have to ensure that they receive the same services offered to any other student on campus. When it comes to how we deal with the LGBTQ community, persons fall into one of three categories. Either they are judgmental, they're tolerant, or they are accepting. How does one move from judgmental to at least tolerant, if not accepting? Tanya, Chevelle, and I focused on improving LGBTQ student satisfaction with health and counseling services, increasing faculty and staff sensitivity and cultural awareness of this student population, increasing collaboration of medical and counseling services. So at this time, Chevelle and Tanya, they're going to share with you how we're moving toward implementation of these goals and objectives.
One was that we wanted to provide LGBTQ sensitivity training to the health and counseling staff. We wanted to advocate for gender-neutral restrooms on campus. We wanted to implement a Safe Zone on campus. Now, Safe Zone is a program that can be implemented on college campuses that will provide for LGBTQ sensitivity training as well as advocating for them. We wanted to have a focus group with the LGBTQ student population to identify issues with accessing student health and counseling services. Increase participation of health services staff in the LGBTQ student organization activities. We, as said, wanted to establish weekly interdisciplinary team meetings, display diversity-friendly pamphlets and brochures in all health services departments, and identify faculty and staff allies by display of signage. Our Capstone project included the staff of the Health and Counseling Services at Virginia State University, the LGBTQ student population, and the faculty and staff of Virginia State University as a whole. As a result of our improvement strategy, what we found was that there was resistance met with specifically the Department of Police and Public Safety. Health Services, specifically the clinic, we partnered with the LGBTQ student organizations basically to increase their familiarity with us on several activities that they had that would include World Kindness Day, the Pride Ball, Stamp Out Stigma, Healthy Body Image and Self-Esteem Day, and Suicide Awareness Day. We tried to advocate for gender-neutral restrooms, but we did meet some resistance with that. And we also provided LGBTQ sensitivity training to faculty and staff members.
So as Ms. Satterwhite said and Dr. Griffin was mentioning, human services, counseling, as well as student health work cohesively together. We're under one umbrella. So the Rainbow Soul organization that I actually am the advisor of, student health did a lot of partnering with to show them that they were definitely allies on campus. And so when she mentioned that we did have some resistance, a little bit more than what we thought, some people were not accepting or affirming, they were more just tolerant. So we were working, the Safe Zone program is a program to work to establish allies throughout the campus, so that we wanted to focus on a small slice of the pie instead of the whole pie. As I mentioned, there was some resistance throughout implementing this program and actually making our students feel affirmed and accepted as a whole. And a small change, or so we thought, was actually a huge ordeal. And the small change that we were referring to is trying to get a gender-neutral bathroom. I work in the council, I'm sorry? Yes, just one. I work in a counseling center on the 4th floor, and we have same-stall bathrooms. It's an old building. They figured that, I treat everyone the same, so what is the big deal? Which actually you don't, because some of our students did notice that they felt judged or they did not feel accepted, which prevents them from exploring their true medical history. So if you're coming and you have a transgender student and they perhaps had top surgery, which is perhaps having a mastectomy, or bottom surgery, which is removing changing your actual sexual genitalia, and you have to speak to that about a nurse or a doctor, what you're about, then you don't feel comfortable. That causes a problem, which of course we know correlates very quickly to mental health and physical health are all the same. So the interdisciplinary team-based care, which we meet every week, we actually had a representative there. We discussed things going on in the medical side, improve our treatment of our HBCU LGBTQ students. I didn't recognize that there was an ally in the director of student activity. She was a strong ally. I didn't know that as outreach coordinator. I'm sure Dr. Griffin nor Mrs. Satterwhite didn't know that. And I think it's just a point of just having a conversation to bring about those things. So if I didn't know it, of course the students didn't know it as well. And the change in perspective is that, we recognize that more awareness, more education is needed when it comes to the LGBTQ community. I think it's just a situation where people perhaps are intolerant, I wouldn't say intolerant, but just not aware. Well, intolerant in some cases. I'll go back to that. Are just not aware of the importance of how, if you don't feel you can be who you are and you're not accepted or affirmed on a campus where you matriculate, then it's going to affect your academics, it's going to affect your mental health. Once we work towards that and we're working in the education component, then they will understand and recognize the importance of affirming and accepting this